Hi, welcome to Elite Pilates. This exercise I want to show you now, I'll explain it in a minute, I'll demonstrate it, is a quadruped hip drop or a quadruped hip hitch. It's technically a hitch and a drop. I'll demonstrate it and then I'll explain. From the side. And whilst not a great view, the best way of seeing actually what's going on is from the rear. Excuse the angle. Now you do that a number of times. So what are we actually doing? Well, the biggest reason I use this is to free up the lumbar spine, to free up the pelvis, to free up the sacroiliac region in particular. So on the back again, excuse me, where the innominate bone, where this side of the pelvis and this side of the pelvis joins the spine here, is referred to as the sacroiliac joint. Now, whenever we sit down, it's physical, it's mechanical, it's the sacroiliac joints. So even I'm sitting now, that take the stress dynamically. They take the stress and they tend to tighten up, become rigid and immobile. Not that the sacroiliac joint has got a massive amount of mobility there, but there is some mobility there. But also what happens, the other muscles on the lower back, around the quadratus lumborum area, all around the thoracolumbar fascia, becomes immobile, stiff, tight, short and tight. And this can massively affect, it usually affects it in low back pain, sacroiliac joint dysfunction, it depends on what type of dysfunction it is, but it's basically, this movement frees it up. Now there's a little bit of a stretch and it's a little bit of strengthening, but again, it's more about mobilizing that area if you want to free a moving spine. So, you can use different height blocks and use your common sense. You don't even need to use blocks, not as effective, it's more effective on the blocks. So you're in a quadruped position and you're hitching the hip directly up to the ceiling. So you can't see, I'm not going to turn around and show you from the back again, although that is the best angle. If we had someone else here to demonstrate, it would be the best. But I'll show you from this side. So what we're trying to do is basically, one side of the pelvis stays still. We're trying to avoid rocking from side to side. The pelvis is basically made up of one bone on one side, bone on the other side. You're sort of trying to free it up by sending one up and dropping it down. That's what you're trying to do in the sacroiliac region. And compare, obviously you do both sides, see if there's a difference on the sides. So again, you can do it just, not as efficient, but you can do it just without any blocks, just to hitch it up. You might want to start off doing that one. You might want to go just to a low block first. Hopefully there's a sort of common sense. So it's not a massive amount of drop. See how you get on with that. And then probably better of all, they can say that if you've got good form, is on a bigger block, on a yoga block. Because you've got a greater range of motion. There's much more stress in that, in a nice way, much more of a stretch, and you've got a greater range of motion to go on with. Now, how you can do it, you can lift it up and hold it for 5 to 10 seconds, drop it down, hold it for 5 to 10 seconds, or you can just use it. I like more dynamic stuff, to be honest with you. Lift it and lower it. Now, at its basic, you can do that. Don't overly think too much about what's going on elsewhere in the body. However, I want to put a block there when I'm doing it with clients, to be honest with you, over. Because what you're trying not to do as you lift is to push out to the side. As you lift, you don't want to push out. This hip, this thigh wants to stay as stable as you possibly can, and you'll get more. It's mechanical. You get more of that going on, which is what you're after. Dropping one side of the pelvis, lowering it. Dropping one side of the pelvis, lifting it up. If this one starts shifting around, you're taking it away, you're taking that mobility away, not making it as strict. But in all honesty, don't overthink it. You're hitching the hip up, dropping it down, and then do both sides, and you're still going to get freedom. You're going to free up that sacroiliac, lower back, lumbar region. And that's the quadruped hip drop, hip hitch, or whatever you call it. Thanks for watching, and I'll see you in another